I just got out of a town hall put on British Columbia's BC United, the official opposition party to the NDP government. The town hall featured their leader, Kevin Falcon, who answered some questions. And I hit him with a very important question. Why hasn't it been enough is enough when it comes to BC's unelected public health lord named Dr. Bonnie Henry, the woman who has given her blessing with her sweeping powers to forbid thousands of healthy and able healthcare workers from returning to saving British Columbians' lives. But I also tied it into an important new develop we're seeing with Dr. Bonnie Henry, and that is the blessing she's been giving on the so-called safer supply drugs that are getting in the hands of little children. You're not going to want to miss this report to hear my question as well as Leader Kevin Falcon's answer and another interview I did in there as well with South Surrey MLA Eleanor Storko, who is also the critic for mental health and addictions.
I used to be the Minister of Health only for 2 years, but I remember it well. It's not my favorite portfolio. Just kidding. It was actually great. There's lots of good things in healthcare, but one thing I was very proud of is we had what was not just me saying it, we had the best cancer care system in the country. And we were recognized internationally for some of the lowest mortality rates for cancer patients. Today, we are the worst in the country. And we are now having to send British Columbians down south to Bellingham to get basic cancer care. Now, I tell you, my friends, that's not a good result. I don't care what political persuasion you are. The last time that ever happened in BC, you have to go right back to the 1990s, the last time this government was in power. That was the last time we were sending patients down south to Bellingham.
Because believe me, in the beginning, they were calling me crazy. But then last week, a report came out from Dr. Bonnie Henry that actually confirms that diversion, there's evidence it exists, and there's evidence that it's a problem in British Columbia.
Freya Humphrey here with Rebel News. Thanks for having us.
Thank you.
You talked about some important issues here, starting with medical issues, the dire issue of our shortages in the healthcare system, as well as the plummeting of how our care for BC patients who have cancer, how that's going downhill, and how the NDP government's drive to bring in more healthcare workers isn't going to cut it for the front lines. You've also many times talked about how despite decriminalization, the safer supply agenda, we are at a record overdoses. But there is a common denominator, sort of an elephant in the room, that is contributing to both of those very important issues. Her name is Dr. Bonnie Henry. She's an unelected official. She is the last unelected health lord to still be implementing vaccine mandates against thousands of healthy, able, capable healthcare workers who are retiring early, cleaning houses in a state of depression and leaving our provinces. She's one of the only health lords in the entire world to still have that mandate. And despite her awareness that these drugs and the safer supply are being diverted into the hands of children, she is backing the expansion of it. The Conservative Party, who is doing well in the polls when it comes to sort of the tug of war between you guys, has called for a petition to have her fired. If your party was to form government or remain as the opposition, what exactly are you going to do to get our healthcare workers back who simply didn't want to take part in an experiment and could be saving lives? And what are you going to do about Dr. Bonnie Henry, the unelected health lord?
Sure. Thank you. She won't be working for us, number one. Number two, I think it's important you know that at a time when we've got a healthcare crisis, we have thousands of healthcare workers that are unable to come back to work. We're the only jurisdiction in North America that is still saying you cannot come back to work. And I called back for as far back as 2 years ago. Almost 2 years ago, I said, bring those healthcare workers back. We need them. I know there's the lead nurse at Langley Memorial Hospital, head of the emergency department, cannot come back to work because Adrian Dix and Bonnie Henry have decided they're not allowed back into our healthcare system. That is just ideological. There's no scientific medical foundation or reasoning for being able to keep them out. Somehow everywhere else in North America said, yes, bring back those healthcare workers, even if unvaccinated, so they can help us deal with the healthcare crisis. I do not know, other than their ideology, why they continue to punish people that could be helping us at a time when we need help in our healthcare system. So thank you.
The review was aimed to understand the challenges faced by people who prescribed safer supply, by people who access or tried to access the program, and as well, and importantly, to understand the broader societal impacts of the current policy and programs, and advice on whether the policy should be continued, and if so, and very importantly, how do we improve and maximize the benefits and minimize any potential harms? This program, this policy, in its intent, is an important part of the spectrum of medical care that we are providing and that we need to continue to provide for people who use drugs in this province.
You came from law enforcement, and you're talking a lot about the decriminalization, the safer supply, and some of the concerns you have on it and what's going on. So start with what you started saying previously, before more people were aware of it.
Yeah, so I was the first one actually in the legislature to bring forward the issues of diversion. And so for people that don't know, that's where a drug that's been prescribed to one person gets diverted to the hands of another. So whether in BC right now that drug comes from grandma's cabinet, or if it comes from so-called safe supply, we don't call it that. They're dangerous drugs. So but you know, the point is that during the pandemic, new risk mitigation guidelines were brought out, and during that time, it completely exacerbated the problem. The pill cost in downtown Vancouver went from $10 a pill down to sometimes 25 cents a pill. And so this isn't just something that Eleanor Sturko made up. I was contacted by a lot of doctors who were blowing the whistle on this entire program. And, you know, from parents, unfortunately, too, some parents whose children died of overdose. And, you know, we have had just absolute denial from this government about the dangers, and even the federal government, to be honest, about so-called safe supply. And frankly, it's been negligent. I believe that also there's liability there in calling it safe supply. We've seen this last week, a report came out from the BC Centre on Substance Use. Dr. Bonnie Henry had given a press conference about it. In the report, they say that there is emerging evidence that there is, of course, diversion, which we already knew. But finally, they've admitted it. But you know, and in the report, they've also said there's evidence that it causes harm. And in spite of that, now we have a doubling down on a failed policy that certainly isn't helping, and in fact might be harming. And it's disgusting, actually.
Now, there's another term for this diversion. I think you called it dillying or something like that?
So the pills themselves are Dilaudid. That's one of the pills that's prescribed in a so-called safe supply. The reason the kids on the street call them dillies is because Dilaudid is the name of the pharmaceutical. And the ironic part, Drea, is that, so if you think back to the beginning of the opioid crisis, it was Purdue Pharma, the overprescribing of OxyContin, dumping large quantities of oxys into the street with very little oversight from the medical community, saying it wasn't harmful. We got into this opioid crisis. It's actually Purdue Pharma that makes Dilaudid. So we're doing the same thing, which makes no sense to me.
Big Pharma wins every time, right?
And so for us in the opposition, and one of the things is that a letter actually went to Yara Sachs from a number of top addiction specialists across Canada who were saying, look, there's a bunch of federal funding that goes to these so-called safe supply programs, and that they shouldn't be funded any longer unless these are recovery-oriented, meaning that it's to transition people to recovery, and that they should be witnessed so that we can help get a handle on diversion. I wrote a letter myself supporting this, and that is the position that our party takes. Like, there's a role for things like methadone and other drugs to help stabilize people, but just an endless source of getting drugs and with no plan to help people recover is no plan at all. And unfortunately, that's the way this NDP government's going.
All right, and last question. I asked a question here about Dr. Bonnie Henry. You mentioned her as well. What would you like to see from her? What do you think is a fair response from someone who is the top doctor of BC and saying okay to something like this?
Well, first and foremost, even through the BC CDC's response and putting out the risk mitigation guidelines, and now these scary guidelines for giving fentanyl, take-home fentanyl to children without parental knowledge, they even say in their guidelines that these are not evidence-based treatments, and that in fact they say that the user should be give their informed consent. But how does someone give informed consent when they're a child? How do we know that they fully understand? And furthermore, and I don't want to get into the weeds too much, but there was recently a court injunction granted for the safe parks and playgrounds, and in that ruling, the judge actually said, and so it's on the court record, that he thought that drug users were largely unable to advocate for themselves. So how do we have a situation where people who are using drugs, particularly vulnerable children, are able to provide informed consent on these unproven, untested, and potentially dangerous treatments, but a judge is saying they don't have possibly the ability to advocate for themselves? You can't have it both ways, and I think that it's irresponsible for us to continue going down pathways that are not evidence-based. It's wrong. And I would hope that Dr. Henry, first and foremost, would be doing more to investigate the pathway of addiction. If you look at the report that the government released just a year ago, and it was looking at youth overdoses from 2017 to 2023, the years of the risk mitigation guideline during the pandemic, you see a doubling every year of the children who died of an overdose, and they had hydromorphone in their system. They had dillies in their system. And while it may not have been the cause of death, why are we seeing it more in youth? And what pathway did they start taking so-called safe supply and then develop an addiction and then move on to fentanyl and then die? I mean, this government has done absolutely zero when it comes to looking at the risks, especially to vulnerable people in the community.
Well, there you have it. MLA for South Surrey, Eleanor Sturko with BC United, Drea Humphrey with Rebel News. When I asked you at the beginning of the year what you wanted to see me cover, it was the upcoming election in British Columbia. And right now, I'm on the campaign trail. If you appreciate these reports, want to be on our email list, and want to support the many costs involved to bring them to you, please go to our special website called BC Leadership Reports for more. I'm Drea Humphrey. Thank you for your support.